Your doctor hands you a prescription at the clinic. You walk to the pharmacy counter. The pharmacist fills a bottle with pills and hands it to you. You bring it home and start taking it every single day. Within weeks, your memory starts failing. You forget conversations you had yesterday. You can't remember where you put your keys. You walk into rooms and forget why you went there. Your family notices you're more confused than usual. They worry you're developing dementia or Alzheimer's disease. But here's what nobody tells you. The medication sitting in your medicine cabinet that you take every single day might be destroying your brain. According to research published in JAMA Internal Medicine, certain commonly prescribed medications significantly increase dementia risk in older adults. A landmark study following over 3,000 participants for more than 7 years found that people over 65 taking these medications had dramatically higher rates of dementia compared to those not taking them. The connection between specific medications and cognitive decline is so strong that researchers can predict dementia risk based on cumulative exposure to these drugs over time. What shocked me when I researched this topic is how many doctors continue prescribing these brain-damaging medications to elderly patients without discussing the cognitive risks. Patients walk out of doctors' offices with prescriptions that will slowly destroy their memory and thinking abilities. Families watch their loved ones decline cognitively and assume it's Alzheimer's disease or normal aging. Nobody connects the dots to the medication bottle sitting on the nightstand. Even more alarming, many of these medications are available over the counter at any drugstore. You don't even need a prescription to buy drugs that damage your brain. You can walk into any pharmacy right now and purchase medications that increase your dementia risk with no warning label telling you about the danger to your cognitive function. In this video, I'll reveal 14 popular medications that trigger rapid cognitive decline and dementia in people over 60. Number 5 is so widely used that millions of Americans take it every single day without realizing it's damaging their brain. Before we start, I need to be crystal clear about something absolutely critical. This video is for educational awareness only. Never stop taking prescribed medications without consulting your doctor first. Abruptly stopping certain medications can be dangerous and cause serious withdrawal effects or worsening of the condition being treated. If you're taking any medications I discuss, schedule an appointment with your doctor to discuss safer alternatives. Now let's dive into the medications that could be stealing your memory and destroying your brain. Understanding how medications damage your brain and cause dementia. Before we examine specific medications, you need to understand the mechanisms by which drugs can impair cognitive function and trigger dementia-like symptoms. Here's how it works inside your brain. Your brain operates through complex communication between billions of neurons, brain cells that transmit electrical and chemical signals. These neurons communicate using neurotransmitters, chemical messengers that cross tiny gaps called synapses between neurons. Different neurotransmitters control different brain functions. Acetylcholine is crucial for memory formation and learning. Dopamine regulates movement, motivation, and reward processing. Serotonin affects mood and emotion. Norepinephrine controls attention and arousal. For your brain to function optimally, these neurotransmitter systems must maintain delicate balance. When medications interfere with neurotransmitter production, release, or receptor binding, brain function becomes impaired. Some medications block acetylcholine receptors throughout your brain. This anticholinergic effect directly impairs memory formation because acetylcholine is essential for creating new memories. Without adequate acetylcholine signaling, information never gets encoded into long-term memory storage. You experience it, but can't remember it later. Other medications cause sedation by enhancing the effects of GABA, an inhibitory neurotransmitter that slows brain activity. While this produces desired effects like reduced anxiety or better sleep, it also slows cognitive processing speed, impairs attention, and interferes with memory consolidation. Some drugs affect blood flow to your brain. Your brain requires approximately 20% of your body's total blood supply, despite being only 2% of body weight. Medications that lower blood pressure excessively or cause orthostatic hypotension, sudden blood pressure drops when standing, can reduce cerebral blood flow. When brain tissue doesn't receive adequate oxygen and glucose delivery, neurons malfunction and can die. Research using brain imaging shows that chronic use of certain medications actually causes brain tissue loss. MRI scans reveal that people taking anticholinergic medications for years show significant brain atrophy, shrinkage of brain volume, particularly in memory-related regions like the hippocampus. Studies published in JAMA Neurology found that greater cumulative anticholinergic medication exposure correlated with lower brain volumes and worse cognitive test performance. The relationship was dose-dependent, meaning more exposure caused more damage. What makes medication-induced cognitive impairment particularly insidious is that it develops gradually. You don't notice sudden dramatic changes. Memory slips happen occasionally at first. You dismiss them as normal aging or stress, but over months and years, the impairment progresses. By the time you or your family recognizes significant problems, you've been exposed to brain-damaging medications for years. Additionally, the effects can persist even after stopping the medication. While some cognitive improvement may occur when you stop taking anticholinergic drugs, research suggests that long-term exposure can cause permanent brain changes. Neurons that died don't regenerate. Brain tissue that atrophied doesn't fully recover. The damage accumulates and may be irreversible. Now let me walk you through 14 medication categories that pose serious risks to your cognitive function. Medication number 14, sleep medications, including non-benzodiazepine hypnotics. Starting with medications millions of Americans take nightly, sleep medications, including zolpidem, ezapicolone, and Zeloplan, are commonly prescribed for insomnia. These pills sitting on nightstands across America pose significant cognitive risks. Here's why they damage your brain. These medications, often called Z-drugs, work similarly to benzodiazepines by enhancing GABA activity in the brain. GABA slows neural activity, producing sedation and sleep. But this brain slowing doesn't stop when you wake up in the morning. Residual effects persist, impairing memory, attention, and processing speed throughout the following day. Research from the American Journal of Geriatric Psychiatry found that sleep medication use in older adults was associated with increased dementia risk. Studies showed that people taking these medications regularly had significantly higher rates of cognitive decline and dementia diagnosis compared to those not using sleep aids. Brain imaging studies reveal that chronic use of sedative hypnotics causes changes in brain structure and function. The hippocampus, essential for memory formation, shows reduced volume in long-term users. What makes sleep medications particularly problematic is how easily people become dependent on them. You take a pill to sleep one night, the next night you can't sleep without it. Your brain adapts to the medication. Natural sleep mechanisms become impaired. You continue taking the pills night after night, month after month, year after year. Many people take sleep medications for decades, accumulating cognitive damage the entire time. Additionally, sleep medications impair the quality of sleep you get. While they make you unconscious, they don't produce natural sleep architecture with proper amounts of deep sleep and REM sleep. You're sedated, but not truly sleeping restorative sleep. If you're taking sleep medications, work with your doctor to taper off gradually. Never stop abruptly, as rebound insomnia can be severe. Cognitive behavioral therapy for insomnia, or CBTI, is the gold standard treatment for chronic insomnia and works better than medications long-term without cognitive risks. Medication number 13, anticholinergic antidepressants beyond tricyclics. Expanding beyond tricyclic antidepressants, other antidepressant medications also have anticholinergic properties damaging brain function. Paroxetine, a commonly prescribed SSRI antidepressant, has significant anticholinergic effects. Here's why this matters. While most SSRI antidepressants have minimal anticholinergic burden, paroxetine is an exception. This medication blocks acetylcholine receptors in addition to affecting serotonin. When you take paroxetine daily for depression or anxiety, you're getting anticholinergic exposure, damaging your memory and cognitive function. Research published in BMJ examined anticholinergic medication use and dementia risk. The study found that paroxetine use was associated with increased dementia risk similar to tricyclic antidepressants. The risk increased with longer duration of use and higher doses. Brain imaging studies show that people taking anticholinergic antidepressants, including paroxetine, have reduced brain volumes, particularly in the hippocampus and frontal cortex, regions essential for memory and executive function. What makes this particularly concerning is that many doctors prescribe paroxetine thinking they're using a safe, modern SSRI. They don't realize it has anticholinergic properties that other SSRIs lack. Patients take it for years without knowing about cognitive risks. If you're taking paroxetine, discuss switching to alternative antidepressants with your doctor. Other SSRIs, including sertraline, citalopram, and escitalopram, have minimal anticholinergic effects. SNRIs like venlafaxine and duloxetine are also alternatives. Never stop antidepressants abruptly. Work with your doctor to taper gradually over weeks to months while transitioning to an alternative medication or treatment approach. Medication number 12, anticonvulsant medications used for seizures and nerve pain. Anticonvulsant medications, including phenytoin, carbamazepine, valproic acid, and topiramate, are prescribed for epilepsy, nerve pain, and mood disorders. These pills affect brain function in ways that impair cognition. Here's why they pose risks. Anticonvulsants work by reducing electrical activity in the brain to prevent seizures. This global dampening of neural activity also slows cognitive processing. Memory formation becomes impaired, attention and concentration suffer. Some anticonvulsants have specific cognitive side effects. Topiramate is notorious for causing severe cognitive impairment, so much so that patients call it Dopamax because it makes them feel dopey. Word-finding difficulties are particularly common. You struggle to remember simple words during conversations. Research from neurology examined cognitive effects of anticonvulsants in older adults. Studies found that many anticonvulsants caused measurable cognitive impairment, including memory problems, slowed processing speed, and executive dysfunction. Long-term use was associated with increased dementia risk. What makes anticonvulsants challenging is that people with epilepsy need them to prevent seizures. You can't simply stop taking seizure medications. However, awareness of cognitive risks allows for informed discussions with your neurologist about choosing anticonvulsants with lower cognitive impact. Newer medications, including levetiracetam and lamotrigine, generally have better cognitive profiles than older drugs. For nerve pain, alternatives including duloxetine or gabapentin may be options, depending on your specific condition. Medication number 11, antispasmodic medications for irritable bowel syndrome. Antispasmodic medications, including dicyclamine and hyoscyamine, are prescribed for irritable bowel syndrome, stomach cramps, and digestive problems. These pills have strong anticholinergic effects, damaging brain function. Here's why digestive medications affect your brain. Antispasmodics work by blocking muscarinic acetylcholine receptors in the digestive tract, reducing muscle spasms and cramping. Unfortunately, these medications don't selectively target your gut. They block acetylcholine receptors throughout your entire body, including in your brain. When you take dicyclamine or hyoscyamine for stomach problems, you're simultaneously blocking acetylcholine in your brain, impairing memory formation and cognitive function. Research examining anticholinergic burden from various medication classes found that antispasmodic medications have among the highest anticholinergic ratings. Taking these medications daily contributes significantly to cumulative anticholinergic exposure and dementia risk. What makes antispasmodic medications particularly problematic is that many people take them chronically for ongoing digestive issues. Irritable bowel syndrome is a chronic condition. People continue refilling prescriptions month after month, accumulating anticholinergic exposure. If you're taking antispasmodic medications, discuss alternatives with your doctor. For IBS, dietary modifications including a low FODMAP diet, probiotics, fiber supplements, and non-anticholinergic medications like linaclotide or rifaximin may help. Treating underlying causes, including food intolerances, stress, or small intestinal bacterial overgrowth, can improve symptoms without medications. Medication number 10. Anti-Parkinson medications with anticholinergic properties. Moving to medications prescribed for Parkinson's disease, certain anti-Parkinson drugs, including benztropine and trihexyphenidyl, have strong anticholinergic effects. Here's why this creates a difficult situation. These anticholinergic medications are prescribed to reduce tremor and muscle stiffness in Parkinson's disease. They work by blocking acetylcholine to rebalance neurotransmitters disrupted by dopamine loss. But blocking acetylcholine in the brain to treat motor symptoms simultaneously impairs cognitive function. Research from movement disorders examined cognitive effects of anticholinergic anti-Parkinson medications. Studies found that these drugs caused significant memory impairment and increased dementia risk in Parkinson's patients. Brain imaging showed that anticholinergic medication use was associated with reduced brain volumes and worse cognitive test performance. What makes this particularly tragic is that Parkinson's disease already carries high dementia risk. Approximately 50 to 80% of people with Parkinson's eventually develop dementia. Using anticholinergic medications to treat motor symptoms accelerates the cognitive decline already occurring from the disease itself. If you or a loved one has Parkinson's disease, discuss medication options carefully with a neurologist. Newer Parkinson's medications, including carbidopa-levodopa, dopamine agonists, and MAO-B inhibitors, don't have anticholinergic effects. Anticholinergic drugs should be avoided when possible, particularly in older patients or those already showing cognitive symptoms. Medication number 9, benzodiazepines prescribed for anxiety and sleep. Benzodiazepines, including diazepam, lorazepam, alprazolam, clonazepam, and temazepam, are among the most commonly prescribed medications for anxiety disorders and insomnia. These small pills sit in millions of medicine cabinets across America. Here's why they damage your brain. Benzodiazepines work by enhancing the effect of GABA, the brain's primary inhibitory neurotransmitter. GABA slows down neural activity throughout your brain, producing calming effects. While this reduces anxiety and promotes sleep, it also significantly impairs cognitive function. When you take a benzodiazepine, your brain's processing speed slows dramatically. You think more slowly, you react more slowly, your attention and concentration suffer. Most concerning, benzodiazepines severely impair memory formation. The medication disrupts the process by which your brain transfers information from short-term working memory to long-term memory storage. You experience events but can't remember them later. This is why people taking benzodiazepines for sleep sometimes engage in complex behaviors like driving a car or cooking food with no memory of these activities the next morning. Research published in the British Medical Journal examined benzodiazepine use and dementia risk in over 1,000 elderly patients followed for multiple years. The study found that benzodiazepine use was associated with approximately 50% increased risk of dementia. Longer duration of use correlated with higher risk. People who used benzodiazepines for more than 6 months showed the greatest dementia risk increase. Another study in BMJ followed nearly 9,000 participants for 15 years. Results showed that people who had taken benzodiazepines had significantly higher dementia rates compared to those who never used these medications. The risk remained elevated even years after stopping the drugs, suggesting permanent brain changes. What makes benzodiazepines particularly dangerous is physical dependence developing rapidly. When you take them regularly for just a few weeks, your brain adapts. GABA receptors become less sensitive, your natural anxiety regulation systems become impaired. Stopping suddenly causes severe withdrawal symptoms, including seizures that can be life-threatening. Many people continue taking benzodiazepines for years or even decades because they can't tolerate withdrawal, accumulating brain damage the entire time. Additionally, benzodiazepines dramatically increase fall risk in older adults. Falls are the leading cause of injury and death in people over 65. Benzodiazepines impair balance, coordination, and reaction time, making falls much more likely. If you're taking benzodiazepines, talk to your doctor about safer alternatives for anxiety and sleep. Cognitive behavioral therapy for anxiety and insomnia works better than medications for long-term symptom improvement without cognitive risks. For anxiety, SSRI antidepressants, buspirone, or psychotherapy offer alternatives. If you need to stop benzodiazepines after long-term use, your doctor can create a very slow tapering schedule, reducing the dose gradually over weeks to months, minimizing withdrawal symptoms. Some people need months to taper safely. Medication number 8, tricyclic antidepressants with strong anticholinergic effects. Tricyclic antidepressants, including amitriptyline, nortriptyline, imipramine, and doxepin, have powerful anticholinergic properties that damage brain function. Here's why these pills pose serious cognitive risks. Tricyclic antidepressants were developed in the 1950s and 60s for treating depression. While newer antidepressants with fewer side effects exist, tricyclics are still commonly prescribed for depression, chronic pain, migraines, neuropathy, and insomnia, particularly in older adults. These medications work partly by blocking acetylcholine receptors throughout your body and brain. This anticholinergic activity produces numerous side effects, including dry mouth, blurred vision, constipation, urinary retention, and most importantly for our discussion, severe cognitive impairment. When tricyclics block acetylcholine in your brain, memory formation becomes severely impaired. You struggle to learn new information, you can't remember conversations or events from earlier the same day, your thinking becomes clouded and confused, you have difficulty concentrating on tasks. Research from JAMA Internal Medicine examined anticholinergic medication use in older adults over many years. The study found that cumulative anticholinergic exposure was strongly associated with increased dementia risk. People taking tricyclic antidepressants, which have high anticholinergic burden, showed dramatically elevated dementia rates. Specifically, taking anticholinergic antidepressants for 3 years or more was associated with 54% increased dementia risk compared to no exposure. Brain imaging using MRI scans show that people taking tricyclic antidepressants have reduced brain volumes, particularly in memory-related regions. The hippocampus, essential for forming new memories, shows significant atrophy with long-term tricyclic use. What makes tricyclics particularly concerning is that doctors often prescribe them for conditions other than depression, meaning people take them without realizing they're taking an antidepressant with cognitive risks. Amitriptyline is commonly prescribed for chronic pain, diabetic neuropathy, migraine prevention, and insomnia. Patients think they're taking a pain medication or sleep aid, completely unaware of the anticholinergic burden damaging their brain. If you're taking a tricyclic antidepressant, discuss alternatives with your doctor. For depression, newer SSRI or SNRI antidepressants have much lower anticholinergic effects. For chronic pain, other options exist, including duloxetine, gabapentin, pregabapentin, or non-medication approaches like physical therapy and cognitive behavioral therapy for pain. For migraines, preventative medications including propranolol, topiramate, or newer CGRP inhibitors may be options. For sleep, non-anticholinergic approaches should be tried first. Never stop antidepressants abruptly, as this can cause withdrawal symptoms. Work with your doctor to taper gradually if switching medications. Medication number 7. First-generation antihistamines available over the counter. Now we enter the realm of medications you can buy without a prescription at any drugstore. First-generation antihistamines including diphenhydramine, commonly sold as Benadryl, and chlorpheniramine, found in many cold and allergy medications, have strong anticholinergic effects, damaging your brain. Here's why these seemingly harmless pills pose serious risks. Antihistamines block histamine receptors, reducing allergic symptoms like sneezing, itching, runny nose, and watery eyes. First-generation antihistamines cross the blood-brain barrier easily, entering brain tissue where they block not only histamine receptors but also acetylcholine receptors. This anticholinergic activity in the brain causes significant cognitive impairment. When you take diphenhydramine, even in normal recommended doses, your memory, attention, and processing speed decline measurably. Studies testing cognitive function before and after taking Benadryl show impairment equivalent to having a blood alcohol level at the legal limit for intoxication. Your thinking is as impaired as being drunk. Research published in JAMA Internal Medicine found that cumulative use of diphenhydramine and other anticholinergic medications significantly increased dementia risk. Taking diphenhydramine daily for 3 years increased dementia risk by approximately 54% compared to no use. Brain imaging using MRI scans showed that people with higher cumulative anticholinergic exposure had lower brain volumes and worse cognitive performance on testing. What makes first-generation antihistamines particularly dangerous is their widespread availability and casual use. People buy them at any pharmacy without thinking twice. They take them for allergies, colds, insomnia, or motion sickness. Many over-the-counter sleep aids contain diphenhydramine as the active ingredient, marketed as a sleep aid. People take these pills nightly for years, steadily damaging their brain without realizing it. Additionally, many people don't realize that numerous combination medications contain hidden antihistamines. Cold and sinus medications, pain relievers marketed for nighttime use, and allergy formulas often include diphenhydramine or chlorpheniramine. You might be getting anticholinergic exposure from multiple sources without even realizing these medications contain the same brain-damaging ingredient. If you need antihistamines for allergies, choose second-generation options like cetirizine, loratadine, or fexofenadine available over the counter. These newer antihistamines don't cross the blood-brain barrier effectively, providing allergy relief without cognitive impairment or anticholinergic effects. For sleep, don't rely on diphenhydramine. The cognitive risks far outweigh any sleep benefits. Instead, address underlying sleep problems through sleep hygiene improvements, cognitive behavioral therapy for insomnia, or discussing prescription sleep aids with lower cognitive risk with your doctor. Medication number 6. Antipsychotic medications prescribed for behavioral problems. Antipsychotic medications including quiapine, risperidone, olanzapine, aripiprazole, and haloperidol are increasingly prescribed to older adults for agitation, aggression, psychotic symptoms, or behavioral problems in dementia. These powerful pills pose severe risks to cognitive function and overall health. Here's why they're particularly dangerous. Antipsychotics work by blocking dopamine receptors in the brain. While this can reduce psychotic symptoms and agitation, it also causes numerous serious side effects, including heavy sedation, movement disorders resembling Parkinson's disease, and significant cognitive impairment. When dopamine signaling is blocked throughout the brain, thinking slows dramatically, memory worsens substantially, processing speed declines, executive function becomes impaired. Many antipsychotics also have strong anticholinergic effects, adding another mechanism of cognitive damage on top of the dopamine blockade. Research published in BMJ examined antipsychotic use in elderly patients with dementia. Multiple studies found that antipsychotics increased mortality risk by approximately 60 to 70% compared to placebo. Death rates were significantly higher in elderly people taking antipsychotics. Cognitive decline accelerated in patients taking these medications. Additionally, antipsychotics increase stroke risk substantially in elderly patients. The FDA issued a black box warning, the strongest warning possible, about increased mortality and stroke risk when antipsychotics are used in elderly patients with dementia-related psychosis. Despite these serious warnings, antipsychotics continue to be widely prescribed to older adults in nursing homes and assisted living facilities. What makes antipsychotic use particularly concerning is that they're often prescribed inappropriately for behavioral symptoms that could be managed through non-medication approaches. An elderly person with dementia becomes agitated or aggressive. Instead of investigating underlying causes like pain, infection, constipation, or environmental stressors causing the behavior, doctors prescribe antipsychotics to chemically sedate the patient. The medication doesn't treat the underlying problem causing agitation, it just sedates the person into submission, worsening their cognitive function and increasing their death risk. If your loved one is taking antipsychotics, question whether they're truly necessary. Ask the doctor about behavioral interventions, environmental modifications, pain treatment, or addressing underlying medical problems causing agitation. If antipsychotics are absolutely necessary for safety, use the lowest effective dose for the shortest time possible, with regular attempts to reduce the dose or discontinue. Medication number 5. Bladder control medications with anticholinergic properties. This is the medication category millions take daily without realizing the brain damage occurring. Medications for overactive bladder and urinary incontinence, including oxybutynin, tolterodine, sulfafonacin, darafenacin, and fesitaridine, are commonly prescribed to older adults experiencing bladder control problems. These pills have extremely high anticholinergic burden, severely damaging brain function. Here's why bladder medications pose such serious cognitive risks. These medications work by blocking muscarinic acetylcholine receptors in the bladder muscle, reducing bladder contractions and urgency. The theory is that blocking these receptors relaxes the bladder, giving you more time to reach the bathroom. Unfortunately, the same muscarinic receptors exist throughout your brain. When you take bladder medications, they don't selectively target your bladder. They block acetylcholine receptors everywhere in your body, including in brain regions essential for memory and cognition. Oxybutynin, one of the most commonly prescribed bladder medications, has among the absolute highest anticholinergic burden of any medication in any category. Taking oxybutynin daily causes severe memory impairment, profound confusion, and significant cognitive decline. Research from the Journal of the American Geriatric Society found that anticholinergic bladder medications significantly increase dementia risk. The study, following thousands of older adults over many years, found that those taking bladder anticholinergics had substantially higher rates of developing dementia compared to those not taking these medications. Brain imaging studies using MRI show that people taking anticholinergic bladder medications have reduced brain volumes and impaired cognitive test performance. The effects are dose-dependent and cumulative. Longer exposure causes progressively more damage. What makes bladder medications particularly problematic is that many older adults take them for years or even decades. The bladder control problems they're treating are chronic conditions. People continue refilling prescriptions month after month, year after year, steadily accumulating catastrophic brain damage the entire time. If you're taking anticholinergic bladder medications, discuss alternatives with your doctor urgently. Newer medications like maribegron work through a completely different mechanism without anticholinergic effects. Behavioral interventions including pelvic floor exercises, bladder training, scheduled toileting, and fluid management can improve bladder control without any medications. Treating underlying causes like urinary tract infections, constipation, excessive caffeine intake, or medications causing increased urination can also help. Medication number 4, muscle relaxants prescribed for back pain and spasms. Muscle relaxants including cyclobenzaprine, carisoprodol, methocarbamol, and tizanidine are commonly prescribed for back pain, neck pain, and muscle spasms. These medications cause significant sedation and cognitive impairment. Here's why they damage brain function. Muscle relaxants work through various mechanisms, but most cause sedation by affecting the central nervous system broadly. Cyclobenzaprine has anticholinergic properties structurally similar to tricyclic antidepressants. Carisoprodol breaks down into meprobamate, a sedative similar to benzodiazepines that was banned in many countries. These medications slow brain activity throughout your entire brain, causing drowsiness, confusion, and memory impairment. When you take muscle relaxants, your thinking becomes clouded and foggy. Your reaction time slows dramatically. Your balance and coordination suffer substantially, increasing fall risk. Research published in Archives of Internal Medicine found that muscle relaxants significantly increased fall risk in older adults. Falls are the leading cause of injury and death in people over 65. Hip fractures from falls often lead to permanent disability or death. Medications that impair balance and coordination directly contribute to fall-related injuries and deaths. Additionally, many muscle relaxants have anticholinergic effects, contributing to long-term cognitive decline and dementia risk. Cyclobenzaprine in particular has high anticholinergic burden similar to tricyclic antidepressants. What makes muscle relaxants particularly problematic is that evidence for their effectiveness is quite limited. Studies show they provide only modest short-term pain relief and aren't superior to over-the-counter pain medications like ibuprofen or acetaminophen. The cognitive risks and fall risks often far outweigh the minimal benefits. If you're taking muscle relaxants for pain, discuss alternatives with your doctor. Physical therapy, heat or ice application, gentle stretching and strengthening exercises, massage, and appropriate pain medications often work better without the cognitive impairment and fall risk. If muscle relaxants are needed, use them for the absolute shortest time possible, just a few days, not long-term daily use. Medication number 3. Proton pump inhibitors for heartburn and acid reflux. Proton pump inhibitors, including omeprazole, esomeprazole, lansoprazole, pantoprazole, and rabeprazole, are among the most commonly prescribed medications in America. These small purple and pink pills sitting in millions of medicine cabinets pose surprising risks to cognitive function. Here's why acid-blocking medications affect your brain. Proton pump inhibitors work by blocking acid production in your stomach. This relieves heartburn symptoms and allows ulcers to heal. But emerging research suggests long-term PPI use increases dementia risk through several concerning mechanisms. First, PPIs may increase beta-amyloid accumulation in the brain. Beta-amyloid is the abnormal protein that forms plaques in Alzheimer's disease. Studies in laboratory mice showed that PPIs increased beta-amyloid levels in brain tissue. The mechanism appears to involve lysosomes, cellular structures that normally clear protein aggregates. Second, PPIs reduce vitamin B12 absorption significantly. Your stomach acid is necessary for releasing vitamin B12 from food proteins. Without adequate acid, B12 absorption declines substantially over time. Vitamin B12 deficiency causes cognitive impairment, memory problems, confusion, and can closely mimic dementia symptoms. Third, PPIs may reduce magnesium absorption. Magnesium deficiency affects brain function and has been associated with increased dementia risk. Research from JAMA Neurology examined PPI use and dementia risk in over 73,000 participants followed for many years. The study found that regular PPI use was associated with significantly increased dementia risk. People taking PPIs had 44% higher dementia risk compared to those not taking acid blockers. Additional studies from Germany following over 70,000 patients confirmed the association. PPI users showed substantially elevated dementia rates even after controlling for other risk factors. What makes PPIs particularly concerning is how casually they're prescribed and used. Doctors prescribe them for heartburn without discussing risks or trying safer alternatives first. Many PPIs are available over the counter without prescription. People buy them without medical supervision and take them daily for years or decades. If you're taking PPIs, don't stop abruptly, as acid can rebound severely, causing worse symptoms. Instead, work with your doctor to taper gradually. Try lifestyle modifications, including elevating the head of your bed 6 inches, avoiding meals within 3 hours of bedtime, reducing portion sizes, and eliminating trigger foods like caffeine, alcohol, chocolate, and spicy foods. H2 blockers like famotidine may be safer alternatives with lower dementia risk. Treating underlying causes like H. pylori infection, if present, can cure ulcers permanently. Medication number 2. Corticosteroids prescribed for inflammation and autoimmune conditions. Corticosteroids, including prednisone, methylprednisone, dexamethasone, and hydrocortisone, are powerful anti-inflammatory medications prescribed for numerous conditions, from asthma to arthritis to autoimmune diseases. These pills can cause severe psychiatric and cognitive effects. Here's why steroids affect your brain. Corticosteroids work by suppressing immune system activity and reducing inflammation throughout your body. While this treats the underlying inflammatory condition, steroids also cross the blood-brain barrier easily, entering brain tissue where they affect mood, behavior, and cognitive function. Short-term high-dose steroid use can cause acute psychiatric symptoms, including mania, psychosis, severe depression, anxiety, and insomnia. People become agitated, paranoid, or suicidal. Long-term steroid use causes more subtle but persistent cognitive impairment that worsens over time. Steroids affect the hippocampus, your brain's primary memory center. They reduce hippocampal volume and impair memory formation. Research published in Annals of the New York Academy of Sciences found that chronic corticosteroid exposure causes brain atrophy and progressive cognitive decline. Studies using MRI brain imaging showed that people taking steroids long-term had significantly reduced brain volumes, particularly in the hippocampus. Memory testing revealed significant impairment in both verbal and visual memory. What makes corticosteroids challenging is that many people need them for serious medical conditions. You can't simply stop taking steroids if you have severe asthma, lupus, rheumatoid arthritis, or other serious inflammatory conditions. However, awareness of cognitive risks allows for informed risk-benefit discussions with your doctor. Use the absolute lowest effective dose for the shortest time possible. If long-term steroids are necessary, regular cognitive monitoring can detect problems early. Alternative immunosuppressive medications or disease-modifying drugs may allow steroid dose reduction. Medication number 1. Polypharmacy, taking multiple medications simultaneously. Taking the top position, the single most dangerous medication situation isn't any individual drug, but rather taking multiple medications at the same time, polypharmacy. Typically defined as taking 5 or more medications daily, dramatically increases dementia risk through multiple compounding mechanisms. Here's why taking many medications together damages your brain. Each medication carries individual side effects and risks. When you take multiple drugs simultaneously, those risks don't just add, they multiply. Drug interactions occur where one medication affects how another is metabolized by your liver. Blood levels of medications rise higher than expected. Side effects compound and intensify. Many older adults take 10, 15, or even 20 medications daily. They have prescriptions from multiple different doctors who may not know about all the other medications the patient is taking from other specialists. Each pill seemed necessary and appropriate when prescribed individually, but the cumulative burden becomes toxic to the brain. Research from BMJ examined polypharmacy and dementia risk in older adults. Studies found that polypharmacy significantly increased dementia risk. Each additional medication increased risk incrementally. People taking 10 or more medications daily had the highest dementia rates. Additionally, polypharmacy dramatically increases cumulative anticholinergic burden. Many different medications have anticholinergic properties, including antidepressants, antihistamines, bladder medications, muscle relaxants, sleep aids, and gastrointestinal medications. When you take several anticholinergic medications together, even if each individual drug has only moderate anticholinergic effects, the cumulative anticholinergic load becomes enormous. Studies using anticholinergic burden scales that rate each medication show that higher cumulative scores strongly predict worse cognitive outcomes and increased dementia risk. What you absolutely must do is comprehensive medication review with your doctor. Schedule an appointment specifically dedicated to reviewing all medications. Bring every single pill bottle, including prescriptions, over-the-counter medications, vitamins, and supplements. Ask specific questions about each medication. Is this still necessary for my health? What are the cognitive risks? Are there alternatives with lower brain impact? Can the dose be reduced? Can this medication be stopped completely? Many medications prescribed years ago may no longer be medically necessary. Conditions that required treatment initially may have resolved. Stopping unnecessary medications reduces cognitive risks dramatically without harming your health. What you must do right now to protect your brain. If you're taking any medications discussed in this video, don't panic and absolutely don't stop taking them abruptly without medical guidance. Instead, take these specific protective actions. First, make a complete, comprehensive list of all medications you take. Include prescription drugs from all your doctors, over-the-counter medications you buy at the pharmacy, vitamins, supplements, and herbal products. Write down the exact name, dose, frequency, and why you're taking each one. Second, schedule a comprehensive medication review appointment with your primary care doctor. Bring your complete medication list. Ask specific, direct questions about each medication. Is this still medically necessary for my health? What are the cognitive risks? Are there safer alternatives available? Can we reduce the dose or stop this medication safely? Third, prioritize stopping or switching the highest risk medications first. Anticholinergic medications, including tricyclic antidepressants, first-generation antihistamines, bladder medications, and muscle relaxants, should be top priorities for elimination or substitution. Work with your doctor to find safer alternatives. Fourth, never stop any medications abruptly without medical supervision. Some drugs, including benzodiazepines, antidepressants, and corticosteroids, require very gradual tapering over weeks to months to avoid dangerous withdrawal effects. Your doctor will create a safe, individualized tapering schedule for you. Fifth, Actively explore and pursue non-medication alternatives for conditions where effective options exist. Cognitive behavioral therapy for insomnia works better than sleeping pills for long-term sleep improvement. Physical therapy and exercise help chronic pain. Lifestyle changes improve heartburn, bladder control, and many other conditions. Which of these 14 medications surprised you most? Are you taking any of these brain-damaging drugs right now? Share your experiences in the comments below. If this information helped you understand medication risks to your brain, please like this video right now and subscribe to our channel for more health content that could save your brain and your life.